Unfortunately, medical scheme contributions remain a grudge purchase for many members and employees. And I think this stems from lack of understanding of the very basic and fundamental principle that is inherent in this long-term sustainability of medical schemes. That we require sufficient young and healthy members in a medical scheme to cross-subsidize the old and the sick. So we need to accept that in our young and healthy days, we don't claim as much as what we are contributing into that. But that should put us in good stead for when we become old and sick one day. What it means is that we shouldn't underestimate what our needs will be in retirement and begin to plan for that. In our years of employment, we need to buy appropriate level of cover, understanding that medical scheme costs compete with many other needs. So we need to buy medical scheme cover that is sufficient based on our needs at the time and what we can afford. By the time we retire, it is probably too late to begin to think about putting money aside for medical costs. In retirement, our demand for healthcare is a lot higher than what it would be during our working years. And also, our income would probably be at its lowest. What is very important, it is for young and healthy people to participate in medical schemes and to remain in the system. Because if they do not do that and try and join later in life, they are likely to get penalties, which includes lifelong late joiner penalties, and those range from anything from 5% to about 75%, depending on how long one has been out of the system. There are a number of reasons why medical scheme contributions increase at a rate greater than general inflation. And in understanding why that happens, we need to firstly appreciate that the medical schemes, the funds themselves, operate as non-profit making entities. So it ultimately boils down to the ability to collect enough contributions to meet their obligations as they relate to their members, as they relate to their service providers, as they relate to their regulatory requirements. So therefore, the operating performance of a medical schemes is crucial in determining the cost increases from one year into the next. Did the scheme collect enough contributions from its members to meet those obligations? And if not, then one needs to consider cost increases over and above those that would normally have come through. What our analysis has shown us is that the schemes in general are receiving more and more claims per member. Over and above that, when they ultimately do receive the claim, the average cost per claim is a lot higher, or significantly higher than that they received in the past. So what this tells us is that not only are more of us getting sick, but when we ultimately do receive treatment, the severity of our condition is such that the cost is higher than that which had come through in the past. The second cost driver for medical scheme increases is the demand that comes through from members. And this is possibly as a result of members that are more knowledgeable about their benefits, about the process and procedures of medical schemes. Furthermore, what one is seeing, it is members that have better access to facilities, to service providers. The third reason, which is also possibly member and provider driven, it is the cost of technology. All the new technology that comes in, all that which helps our doctors better diagnose what is wrong with us, comes at a cost for medical schemes. Similarly, all these new wonder drugs that are coming in that prolong the quality of life and the treatment that our members receive come at a cost for medical schemes. The last cost driver that I would want to mention is a regulatory one. All medical schemes must by law hold in reserves 25% of member contributions. So therefore, for any growing medical schemes, it is an ongoing challenge. For every new member that joins the scheme, there is an obligation for the scheme to keep a certain amount of money in reserves to cater for that growth.